Okay, everyone. So today we're going to talk about corticosteroids, or as most of you probably know them, as they are steroids. They are cortisone-like medications that are used to treat inflammation in the body. So the main function of corticosteroids, no matter what they're used in treatment, and they are used to treat a whole lot of things, is that their main use is to combat inflammation, is to decrease inflammation within the body. So they are used to decrease swelling, redness, and itching, might be used for a number of conditions which include those symptoms. So of course, steroids are administered for allergic reactions like hives or rhinitis, any sort of inflammatory condition, and that includes inflammatory bowel syndrome or IBS. Inflammatory conditions also include arthritis. Certain corticosteroids, or steroids to shorten the word, might be used to treat arthritis, as well as eczema, other inflammatory skin conditions, lupus as well, which is an immune disorder where the immune system is attacking the body and causing inflammation that's very, very systemic, as well as they may also be used in respiratory inflammation. So that could be asthma, COPD, and I would encourage you to look at the respiratory lecture for inhaled corticosteroids that I do talk about in the respiratory drugs lecture. But in this case, we are going to be talking about more of our oral and our nasal corticosteroids in this one. Now, side effects of corticosteroids and some things to consider. We always want to avoid long-term use. Why? Because long-term use can sometimes cause what's known as immunosuppression, otherwise known as a lower resistance to infection. So things that you wouldn't otherwise get sick from, if you're using corticosteroids for a long time, your body's inflammatory processes, which are mediated by the immune system, are not as efficient at fighting those otherwise very, very easy to defend against viruses and bacteria off. Therefore, your immune system is suppressed. Now, steroids can also increase appetite as well as cause weight gain because they sort of mess with your metabolism. They can also cause nervousness, restlessness, or difficulty sleeping. If I'm ever taking prednisone, which I have in the past, prednisone is a steroid drug, a corticosteroid drug, and prednisone, I always counsel my patients to say, don't take it after 4 p.m. every day. So don't take it after 4 in the afternoon if you have trouble sleeping. Like if you have trouble sleeping after having a cup of coffee in the afternoon, the steroid is going to be worse because it'll make you fidgety, restless, maybe difficult to sleep. So usually, if we can, we try to space out the dosing of steroids. So even if it's multiple times a day, you would at least just take it at one set period that's not too close to bedtime. Now, a swollen or puffy face can also be a side effect of corticosteroids, as well as changes in mood. People may report, and this comes down to if you're using very, very large quantities of corticosteroid. You might have heard of roid rage. That's if people are abusing steroids, anabolic steroids specifically. So the people who have those impossibly large muscles at the gym, they might go into sort of fits of rage or be quick to anger, short temperament, and that's associated with steroid use as well. Not so much with the ones that we prescribe at the pharmacy though. And acne can also be associated with steroid use. So just things to keep in mind. Now, I divided the corticosteroid categories into two very, very broad categories. So these are all steroids, but we have our oral, liquid, intravenous, multiple dosage form steroids, and then we just have our nasal corticosteroids, which are at the bottom. So, and I did put the note there, and you should be mindful of that almost all of these steroids come in multiple dosage forms, but this is just a generalized way to organize them. As you can see right here, we've got our methylprednisolone or Medrol. It can come as an IV dose, or you see these all the time in pharmacies, inpatient or outpatient. You get the methylprednisolone tablets or Medrol pack, and this is known as the Medrol pack, and it literally tells you exactly how to dose it within the pack. So it comes pre-packed and pre-dosed for the patient. So it's really, really easy to take as long as the patient follows the directions, which are right on the pack. Anyway, more examples of corticosteroids. We have prednisone or Deltasone. It's probably one of the most common ones. I'm sure if you've ever had a sinus infection or a pneumonia or some sort of inflammatory upper respiratory tract condition, you've probably been put on prednisone at some time in your life if you don't have a sensitivity. Like I just said, we have Medrol or methylprednisolone. We have dexamethasone or Dexpak. Dexamethasone is actually quite useful in treating COVID of all things and the severe inflammation that can cause. In addition, we have hydrocortisone, which you may have heard, very, very popular topically, otherwise known as Cortef, and triamcinolone or Aristocort. And then we have our two nasal corticosteroids, which are Fluticasone or Flonase and Mometazone or Nasonex. So let's get started. These are our common corticosteroids. As I said, Prednisone or Deltasone is probably the most common steroid prescribed for inflammatory conditions. Its dosage forms include a tablet, a delayed release tablet, or liquid. And its dosing really depends on conditions. So it's commonly a tapered dose where it starts high and decreases day by day. And those directions for that can be hard to remember for the patient. So often they come in these pre-made packs that tell the patient exactly what to do. So as you can see, this is organized by day. This is a unit of 21 tablets of prednisone, 5 milligram. And as you can see, on the first day, take 2 tablets before breakfast, take 1 tablet after lunch, take 1 tablet after supper, take 2 tablets at bedtime. Then on our second day, we're decreasing the dose. So instead of, in this case, 6 tablets, we're going to go down to 5 tablets on the second day. So take 1 tablet before breakfast, 1 tablet after lunch, after supper, then 2 tablets at bedtime. Third day, we're down to 1 QID. Fourth day, we're down to 3 times a day. Fifth day, we're down to 2 times a day. And then on the 6th day, you're just taking 1. So that's a very, very common prednisone taper, and you'll probably have experience or will have already had experience entering in those very, very difficult and long to write SIGs, where many physicians just get lazy and write, well, use as directed on the box, which isn't the greatest for patient direction, but we deal with it. Anyway, methylprednisolone or Medrol, it's a little bit stronger than prednisone and it has similar counseling points like the ones I pointed out already. And it also comes in dose packs, as you saw on the previous slide. And then we have dexamethasone or Dexpak. It's often seen IV, especially in hospitals for patients with severe inflammation. It's very commonly used, especially in kids with like childhood meningitis or swelling of the brain. And it also comes in an oral form. Now, it might be useful for reducing COVID-related airway inflammation. That's one of the really exciting things about dexamethasone because it's so potent that it is able to take down a lot of that inflammation that we see in COVID. And it also comes in dose packs when it's orally dosed. Next, we have our hydrocortisone or Cortef. And the hydrocortisone, you're probably most used to seeing it topically, but it also comes in IV or as an oral tablet. And it comes in both over-the-counter and prescription strength as a topical formulation. So you can see right down there that hydrocortisone cream. You'll see these in any aisle in any drugstore, marketed as an antipruritic or anti-itch. It can also be used to reduce inflammation, say if you got poison ivy or something or had a rash. Hydrocortisone is the way to go there. When administered, though, in a hospital, how you might see it in a hospital setting, it's systemic or whole body inflammation like severe allergic reactions or septic shock. If a person has septicemia or what used to be known as blood poisoning, that might be treated with an IV hydrocortisone or Cortef as well. So it's an extremely versatile corticosteroid. Similarly, we have Triamcinolone or Aristocort. That is a topical steroid, and it's used for a variety of skin conditions, most commonly eczema, dermatitis, or just inflammation of the epidermis, the dermis, the top layer of skin, and allergic itching or redness. And you could probably see a little bit more about Triamcinolone in the dermatology video that I put up for you guys. Now, we want to remind each other to wash hands thoroughly before and after use. Not just Triamcinolone, but any topical medication. If you are applying it without gloves, then you got to wash your hands, keep your hands away from the eyes and the mouth. That is probably the most important counseling point. Now, note that topical medications have a lower risk of systemic side effects. So, for instance, I mentioned that a lot of people, or I shouldn't say a lot, but many people report having symptoms of restlessness or difficulty sleeping if they take those oral steroids too late in the day. Usually you don't have trouble sleeping when you're on a topical corticosteroid, mainly because it's being absorbed directly where it needs to act in the body, and it doesn't have to go through any other channels in the body to get where it needs to be. So when you're more directly applying it, and this is the general rule for most topical medications, most people don't have systemic or full body effects. Now we also have our nasal corticosteroids. This is one of the first treatment options considered for allergic rhinitis or just your seasonal allergies, which would cause nasal inflammation. And they work by decreasing inflammation in the nose. So like I said, it's directed right in the nose, right where it's supposed to be working. And it helps decrease swelling and nasal congestion, and also allows for better drainage of mucus, because if you don't have all that inflammation, if you don't feel all stuffed up, that mucus will drain. Now we have Fluticasone or Flonase. It's the same drug used in Flovent inhalers. So you might, if you see Fluticasone on the exam, it does have two brand names depending on how it's being used. The Flonase is the nasal formulation, the nasal spray. The Flovent is an inhaler, so that is an inhaled corticosteroid. So when it's a Flovent, it's used to prevent asthma attacks by reducing inflammation in the whole respiratory tract because you're inhaling it. When it's Flonase, it's only used as a nasal spray. It's only working on that upper part of the respiratory tract, right in the nose and sinus. Now, both are over-the-counter and prescription strength, so they have options with the nasal spray. And lastly, we have Mometazone. You might remember back in the day, I think Antonio Banderas or some other famous Spanish actor was playing the bee that was recommending Nasonex on the television. So I always think of the television commercials and the Nasonex bee whenever I hear of Mometazone. It is a nasal spray, and it's sometimes also used topically for skin conditions, but you will really, if you see Mometazone, think Nasonex. And that is just about it for corticosteroids. As always, if you have any questions, feel free to contact me. Thank you very much.